Okay, now let's conclude here about the heart because we detailed it, and here's the rest of the information. Let's talk about supplements again that may make the heart worse, and those supplements that are you would be advised not to use these kinds of supplements when there is a heart condition. L-tyrosine, L-phenylalanine, SAMe, alpha-lipoic acid, ginseng, tonkat ali, yohimbine. Stimulants there are many other stimulants that will enlarge the problem that we're having with the heart. So we want to be careful of stimulants. However, one of the greatest stimulants that's safe for the heart and will stop a heart attack is cayenne pepper. A level teaspoon of cayenne pepper in some hot liquid, coffee, tea, water, juice, whatever you've got right handy at the minute. Hot water and cayenne pepper will stop a heart attack, will bring people out of shock, will restart the heart if you can do that. You know, high doses of vitamin D can also help can be detrimental to vitamin D. Can be detrimental to the heart. Atrial fibrillation and stroke. And during an episode of atrial fibrillation, abnormal electrical activity in the heart causes its upper two chambers to beat in a rapid, uncoordinated rhythm. The arrhythmia itself is not life-threatening, but over time, AF, atrial fibrillation, can contribute to stroke or heart failure in some people. Multiple trials have established that antithrombotic therapy decreases stroke risk, like aspirin, and a better thing than aspirin would be the origin of aspirin. White willow bark is safer than aspirin, which causes a relative risk reduction of about 20%. So white willow bark, that it does not harm the stomach. Aspirin, which does hurt the lining of the stomach. It's an acid. So I use white willow bark. We're talking about 15 to 30 drops underneath the tongue. And an adjusted dose in warfarin, the international normalized ratio, 2.0 to 3.0, is associated with a relative risk reduction of about 60%. So if warfarin, which is a poison that you give to a rat to kill it, and warfarin is more effective than aspirin, and it's used less often because of the hemorrhagic risk and inconvenience of coagulation monitoring. So you would want to use instead of that, and instead of warfarin, sassafras. And you don't want sassafras tincture. You want sassafras tea. So it's going to taste like root beer, and that's going to reduce by 60% a risk of atrial fibrillation. Now, scientists don't know all the causes of atrial fibrillation, but its risk factors include high blood pressure, obesity, are common problems, and sleep problems called obstructive sleep apnea may raise the risk. A common cause of atrial fibrillation is an overactive thyroid gland. So we have a formula called gland rejuvenator that helps to restore the glandular system back to work again. Older men who were during their 20s, who were big during their 20s, face an increased risk of suffering from AF. A European Heart Journal online, March 20, 2009, said that. And having diabetes increases the risk of a heart condition. Diabetes Care, October 2009, and Journal of General Internal Medicine online in April 2010. And then smoking cigarettes can increase a person's chance of getting a heart condition. And excessive exercise, vigorous exercise may increase the risk. Obesity as a risk factor. And obesity is a cause for developing atrial fibrillation. And the risk rises as body mass index BMI climbs. Atrial fibrillation due to prescription medicines, certain osteoporosis drugs, including Fosamax, made by Merck Inc., and reclassed by Novartis and AG, are linked to atrial fibrillation, and bisphosphonates increase the rates of serious atrial fibrillation. Women who have used alendronate, also known by the trade name Fosamax, have increased risk of atrial fibrillation. And whether the benefits of Fosamax use in terms of fracture prevention in patients with osteoporosis are outweighed by the risk of atrial fibrillation remain to be determined. The regular use of non-steroidal anti-inflammatory drugs, NSAIDs, and newer anti-inflammatory medications known as COX-2 inhibitors, steroid use could also cause atrial fibrillation. And treatment with high doses of corticosteroids, regardless of the indication, increase the risk of new onset of atrial fibrillation. In May 2006 archive of the Internal Medicine, Dr. Stricker received corticosteroids, and high doses of corticosteroids may affect the balance of potassium in cardiac muscle cells, which may include arrhythmia or may cause sodium and fluid retention, leading to hypertension, the left atrial enlargement, and congestive heart failure, all known risk factors. Atrial fibrillation and alcohol. Those who consume a large amount of alcohol are more likely to experience atrial fibrillation, a heart rhythm problem, than peers who consume little alcohol. AFib due to excess alcohol use can occur in men and women. Incidence of the number of people with atrial fibrillation is higher than previously estimated and increasing. In a study in Minnesota residents, the incidence of atrial fibrillation rose more than 12% between 1980 and 2000, at the rate of the number of U.S. residents with the rhythm will rise to 16 million by 2050, nearly 3 times more than the previous estimates. So atrial fibrillation treatment is directed towards the prevention of thrombolism, control of the ventricular rate at the conversion to sinus rhythm. Most people who have atrial fibrillation need more than one type of treatment. Treatment options may include non-surgical procedures, medications, medical devices such as pacemakers and surgical procedures. Medications, antiarrhythmics, are prescribed to restore normal sinus rhythm. The medications relatively maintain sinus rhythm for at least 1 year in about half of the patients treated. However, atrial fibrillation medications can cause side effects such as nausea and fatigue. Digitalis has serious side effects. Digitalis side effects. Digitalis does not improve mortality. People with atrial fibrillation who are treated with digitalis are at at increased risk of death. Dr. Knut Gusdal of the University of Oslo, Norway, have found that digitalis increases the exercise capacity and reduces morbidity in patients with heart failure. However, those who take digitalis have no survival benefit. That's according to Hart, 2008, 94, 191 to 196. New options for atrial fibrillation and new non-pharmacologic possibilities have emerged. Those include surgery, radiofrequency, catheter ablation, pacing, and atrial defibrillation in the treatment of atrial fibrillation. Atrial fibrillation, a non-cognitive function, men with atrial fibrillation score significantly lower on cognitive performance tests than their peers without this dangerous heart arrhythmia. A variety of factors link atrial fibrillation to decreased cognitive performance, including undiagnosed stroke, lesions on the brain, and induced cardiac output. Perhaps medications used to treat atrial fibrillation may also be a factor in causing it. AFib. AFib is caused when the electrical impulses in your heart do not start at the sinus node. Instead, those impulses can start at many different places in the atria or upper part of the heart. When the heart is in AFib, the atria is in a chaotic state and cannot provide enough blood to the lower part of the heart and to the rest of your body. Your heart can diagnose AFib, your doctor can diagnose AFib by a simple EKG or by wearing a Holter monitor. So again, magnesium plays a strong role in the contraction and relaxation of muscles. When the body is low in magnesium, it can cause the heart to develop arrhythmia. The average person should consume between 310 and 420 milligrams of magnesium daily. Those who are on diuretics or deficient should consume foods such as beans, fruits, nuts, and leave out the soy, and whole grains. And if your diet does not support a healthy magnesium level, you should consult your physician about adding a supplement like Nice Bones, number 2455, and potassium in your diet, which help many people who are in AFib are found to have low potassium levels. And potassium can slow the heart down by increasing the time that the heart rests between beats and keeps the heart in a normal rhythm. And however, when potassium becomes too low, the heart becomes excitable and starts to increase electrical impulses, causing AFib. To avoid potassium deficiency, you should consume between 1,600 to 2,400 milligrams of potassium in your diet, and consider taking an oral potassium supplement. And coenzyme Q10 is an antioxidant found in every cell in the body, and its main role is to produce energy in the cells, mitochondria, which fuels the heart function. However, it also acts as a stabilizer in the heart's electrical conduction system. And CoQ10, according to the Heart MD Institute, you should consume between 100 and 300 milligrams of CoQ10 daily for increased heart strength. Again, fish oils. Some studies have shown the benefit of using fish oil to treat certain heart conditions, and research published in the Journal of the American College of Cardiology, JACC, described 4 clinical trials that suggest fish oil may help prevent heart attack and heart failure. But the same study notes that these clinical trials failed to prove the benefit of fish oil in treating atrial fibrillation. Another recent study published in JACC also concluded that fish oil did not reduce atrial fibrillation symptoms, but it is good for the heart, and it is good for diabetes, and it is good for a lot of other things. And finally, taurine. Researchers reported on the benefits of taurine for atrial fibrillation patients in the journal Medical Hypothesis. Taurine is an amino acid that may be taken orally as a supplement. The study found that taurine, Taurine, may help prevent irregular heartbeat by regulating mineral levels in the blood and tissues, and researchers believe that taurine may be effective in atrial fibrillation, partly because it decreases nervous system activity. And I had one person report back to me that it also was the missing key to lowering blood pressure for that person. All of a sudden, when they took the taurine, the blood pressure was then able to go back to normal. Well, that's it. And I'm going to leave the lines open here for just a minute. That is the heart report on herbalhealthreview.com. And that heart report is under common conditions, under heart, on herbalhealthreview.com. This video that I've just created with a copy of that report and an audio video will be available on Discoveries in Health on herbalhealthreview.com. Go to Discoveries in Health and then scroll down, and there are all the videos in a playlist, and this will be there amongst them, and you can look at all the different videos that you would like to look at and thumb through them. There's last week's and the week before and the week before that. So that's how to get that information. And before we go, we had so many problems here. I want to make sure that I've answered people's questions. Is there anyone, I'm going to unmute the mics, is there anyone who has a question before we dash off into the sunset? Any questions here before we leave? We're about to conclude the program, but I want to make sure you have a chance to ask a question. Do you have any questions? The lines are... Go ahead. What is your question?
My question is, I did come in a little late on your on the program, but my question is, I've been taking high blood pressure medication, and it's hydrochloride and diazide, and I'm taking that currently. But the thing is that I feel that it makes me a little dehydrated at times.
How much water are you drinking?
trying to drink at least probably about 45 ounces a day. Sometimes I may drink more.
45 ounces. Okay. What is your weight?
My weight is like 230.
230. Not enough water. Because about a 135-pound person needs about 64 ounces of water a day. Now, if you're getting soup and juice and so forth, you can count that in, those liquids, but you need 64 ounces of liquids, quality liquids, daily. So you're not getting enough water. And one of the things that we can do to help that would be to, in the morning, have a big 16-ounce glass of water. Put a slice of lemon in it so that it drives it alkaline. Put a pinch of Himalayan sea salt, a very small amount, less than a pinch. It's a little bit of Himalayan sea salt. Now it's mineralized. You got all the minerals and ancient minerals, and you've got alkaline water, and you're sipping on that in the morning, and then if throughout the day, if you do the same thing and set little traps for yourself, set some water, on your desk. Set some water. If you're going somewhere, take a water bottle with you, and just keep sipping so that you can try to get through more water. And the reason you feel dehydrated is because actually you are.
Okay, so for my weight, I should drink at least 64 ounces a day.
Yes,
if not more.
that's correct. You're at 45. Let's get it up to. Let's try to see if we can get it up to 55 or 65. Let's see if we can start increasing this. And so that you're comfortably increasing it, and so that you're not thirsty.
Okay.
Let's see how that works for you, and then come back and let us know. And is there any other question?
That salt that you said that I need to put in there, can that be found at a whole food store or herbal store?
Now you wanna contact the people at betterhealthherbs.com, and that product number for Himalayan salt, pink salt, which is the richest in minerals of any salt on earth. The Himalayan pink salt is number 8750. Ask them for some of that 8750 Himalayan pink salt. And that is a very safe salt to put into your diet. Then you're using just a little bit in your water as you go along. So because we don't want you to have a high salt intake, but we do want to give you a teeny bit of these minerals in your water, so that you're highly mineralized. And that you've got the slice of lemon in there, so that it drives it alkaline.
Okay.
And then so that your body is not quite so acid, because disease loves acid. Cancer can't survive unless it's acid, unless your body's acid. So we like to drive the body a little bit alkaline. About 7.4 is perfect. So is there any other question? Do you have any other question?
No, thank you.
Oh, okay. All right. And we're here every Thursday. And this time we had some audio difficulties. The Google Hangouts wouldn't load up, and it's supposed to load up, and it's supposed to load up the Uber conference, and it didn't happen correctly. And so then I had to go by telephone to Uber conference, and then we thought we had the the Google Hangouts working, and I disconnected the Uber conference and didn't realize for about 40 minutes I was talking to myself. And however, we made a video of this, and that video of this broadcast is available on herbalhealthreview.com under Discoveries in Health. It'll be there next week, and all the other videos that we've made in the past, they're also there, and as well as the videos up there under Dr. Burst's Live Consults. There's another 100 videos on that. So that you've got all these videos, and then you've got the excuse me, I need a drink of water, and I don't have one here. So there's the Discoveries in Health videos, and there's also the Dr. Burst videos. Then there's the Common Conditions, and then there's also about all about us, and you can leave a testimonial if you're getting helped, and if this is helping you, leave a testimonial. Encourage others to use this information. One of the greatest reports before I leave that you're going to see here is under Common Conditions, and it's that Make Lifestyle Changes report. And then all these other reports. All of these reports, they all have links to the products, so that you're looking at about a product, and if you're looking at heart disease, then it's going to tell you, or you can click on the product. It'll take you over to betterhealthherbs.com. And if you have any questions, you can contact the folks. That's where you can get all of these products, and that's where you want to get all these products, because it supports it supports my family. That's my family. That's my granddaughter, and we want to support her. Call 541-791-8400 and ask all about Noni Juice, and ask all about these products. Thank you for joining us here on Discoveries in Health every Thursday from 3 until 5 Pacific Standard Time. We'll be back again, and hopefully next week we'll get it all running correctly. But for now, we did what we could. We leave all this in the hands of the Most High, praising the Most High in the name of Yeshua. All praises to the Most High, our Father which art in heaven. Hallowed be thy name. I am. All praise to you, Most High.
Amen.
Amen. Bye for now. Shalom.